Hi guys, good morning. It's Shimona Clark, family nurse practitioner for Clark Nelson and Associates, and I'm here with another cup of the morning coffee. I started doing the morning coffee talks because I'm always consulted by friends, Facebook, neighbors, anyone who knows that I work in healthcare. They ask questions. So I decided, instead of answering the same question over and over again, let me make a little video and provide it, and that way you guys can share it, or you cannot share it, but you can refer back to it, either or. Now, let's get started. The topics for today's morning coffee are palliative and hospice care. And although these are two separate programs, it's actually a family of services that work together to provide transitional care for you and your loved ones. So, you are probably wondering, what is palliative and what is hospice care? Well, palliative care is a program that provides you and your loved ones with education on your disease and disease processes. Now, they also provide you with assistance in obtaining treatment options and actually kind of choosing the appropriate ones for you and your loved ones. While hospice focuses more on comfort management and quality of life. And in doing so, they manage pain and other symptoms. Now, what's the big difference between palliative and hospice? Because you said that these were two separate programs. They are. The main difference is when they're available. Now, palliative is available anytime you have a serious illness or receive a diagnosis, while hospice care, is available when that disease or serious illness has become terminal and life-limiting. Now, on palliative care, you can still receive, and that is actually what the basis of palliative care is. They assist you guys in getting the treatment options, which means that you can receive life-prolonging treatments and care and curative care while you are on palliative care. However, on hospice, this is when you have been deemed that your illness is terminal and life-limiting. So those extensive treatments, or just life-prolonging treatments, I guess we should say, those would cease then, and we would turn the focus to more providing you with comfort and quality of life at that point. So here's some questions that I think are important for any family or patient who may not be sure if palliative and hospice is right for them, or once you have kind of made the choice that you want to, or it's been suggested to you to seek these services. Now, the first question that I think that is very important is to ask what palliative and hospice care is not. And the reason why this is an important question is because there is a stigma with both of these programs that they kill people, or that they are giving up on them, on the patient, or the patient giving up on themselves in life. That's not true at all. Guys, I've got well over 5-6 years of experience working in both of these areas, which are typically, as I said, they work together as a family and they transition the patient. So what they do is they provide another level of care. An additional nurse, an additional social worker, an additional nurse practitioner or physician to assist you guys in obtaining the best quality of life, no matter what stage you're in. So that's a good question to ask, because personally, being a hospice nurse and being there from transition from palliative to hospice, it can actually be a really beautiful and supportive program for not only the patient but their family members, who ultimately the patient is more concerned about than themselves generally. So next, what services do you offer? So this is a question that obviously you should ask once you have kind of made the decision of what service you're going to go to. Now, obviously, I am affiliated with Sanctuary Hospice, so that would be my first choice, but I am not pushing anything on you. You make that decision for yourself, but you always want to ask these questions no matter what service that you choose. So what services do you offer? If I'm on palliative care, do you guys offer pet therapy? Because that's been shown to help to relieve some pain symptoms or things like that, to make people happy. Maybe you're not interested in pet therapy, but maybe you need talk therapy, which is just like having a therapist. Do you guys offer that? And maybe this is also something, these programs, since these programs are like sisters, the services are kind of like clothes. They can be interchangeable based on your where you're at in the process. So, next, if I choose you, does my insurance cover these services, or am I at risk for there being some out-of-pocket costs for myself and my family? Most of us, we worry every day to day about money and how are things going to be paid for, and sometimes we even neglect ourselves because we're worried about the cost. So that's a good question to ask, and ask, are they covered by my insurance, private insurance, or Medicare? And if they are covered by this, to what extent? 100%, or will there be something that I should expect a bill for? So after that, I think that I would ask, what can I expect from you as an agency, as a palliative care, as a hospice? What can I expect? What type of not only services and supplies, but what can I expect? Tell me about yourself. Now, this is important to know because if I see this all the time. In some of these agencies, if the staff that are maybe, it doesn't even matter really what their position is, but if the staff doesn't know what the mission statement is of the company, or it has not been articulated to them what you can expect from them, then typically that's what you expect, for them not to know. So if they don't know, they don't provide it. Now, is there a 24-hour nurse service or on-call service that if I have questions or concerns, or if something comes up, or if myself or my loved one has a change in condition, that I can reach out to someone? Or what is it that is expected of me? What do I do? Then, what is a timeline of the provision of care? For instance, if I sign myself or my loved one up on hospice, when does hospice start? And what can I expect? What is the timeline? When will the nurse be here? Are there supplies that I can request from you? And if so, what's the list of these things that are available to me? And then when will they be delivered? When will I be able to start utilizing them? Next, when can I expect the nurse or any of your other staff, whether it's going to be physical therapy, occupational, nursing care, the chaplain, social services? All of these things, I would like to have a timeline. And although I understand I can be flexible, but there's something that, again, that I should be able to expect, like a bare bones of this. And then you guys, can I expect communication from you? Like, I don't want to go 2 or 3 days without hearing anything when I've been told that some supplies should be delivered to me today by 8 p.m. And now it's 2 days from now, and I still haven't heard anything. So, again, just to kind of recap, although palliative and hospice, again, are two separate services, or two different programs, the services that they offer often transition you from, I've received this diagnosis, and although it could manifest into something worse, we're going to do everything and you're going to provide me with education at this level to prevent me from going to the next level. Now, that next level, again, would be the hospice care. Once that condition or disease process has progressed into being terminal, what can you offer me there? I have seen hospice be such a beautiful, palliative and hospice, be such beautiful programs, and the families feel included. The patient is then comfortable. Their quality of life is better because they have been educated and provided with a list of kind of things to expect. And maybe some of these expectations are out of order because it depends on also the patient and the care that they are also giving. Now, myself as a person who experienced hospice with my own father, I love hospice. I love palliative care. And I suggest this to my patients all the time. But I also, once I speak to my patients, I also ask them if they would like for me or for myself or a representative to reach out to their families, because that's what these programs are about. I don't know about you guys, but even myself, when I'm not feeling good, it feels better for my friends and my family and my loved ones to show me that they care and want to be involved. Not that you have to be here every second to tell me, oh, it's going to be okay. Or, I mean, hey, maybe I just have the flu, or I'm just not feeling good for whatever reason. But knowing that you have support and that your loved ones are okay with wherever you are at and whatever your transitional process is just amazing. And so I'm hoping that this video is shared, and or you just take the information and you speak to your friends and your family about it. Because again, with the palliative, this program is available to you as soon as you receive any diagnosis. So there's some of us that are walking around right now that are borderline diabetic, or we have pre-hypertension. Those are diagnoses. Now, that doesn't mean that they're going to take me in to get my money and to get extra money. No, this means that I'm going to receive an additional service where maybe, especially now with COVID, I'm not able to go into my physician office. So where would the education really come from? I'm still eligible for a palliative care for them to kind of walk me through. Hey, you have hypertension or diabetes or cancer or any of those types of conditions that require education, early education. And they can be life prolonging, just receiving education on diet and exercise, change of scenery. I know, like recently, we've had some patients with PTSD, obviously with the COVID going on, COVID patients. We've also had patients with cancers and things like that. And they don't even know like where their nearest hospital is that can provide them with care or education, where there are wings specifically for oncology and cancer, or the diabetes center, women's health, men's health. Any of these conditions, you can reach out and be provided with even community services and leads to what you are eligible for. So, again, this is Shimona Clark, family nurse practitioner for Clark Nelson and Associates, and this has been another cup of the morning coffee. Stay tuned, guys. Thank you.